Hey guys, Jake here. I'm wearing a webcam on my face to do this training, so bear with me. The lighting is giving me some issues too. I'm having some focusing problems. Um, the things I do for y'all. Okay, so Pulsara app. This is what comes up. Now I've preloaded my login information. I log in, and the first thing it's going to ask me is who's on what ambulance. Now in this case, it's a really bad day in Lavaca County. So Tim Decker and Michael Furr are currently on Medic 1, and then there's a corresponding phone number for that truck as well. Now, once I've entered that information, I hit continue. It takes me to the dashboard. Now, this dashboard will basically give you a list of all the patients you've had in the last 10 to 15 days or so. Not exactly sure how far it goes back, or if that's something that we can set, but these are two test patients we did earlier today. Now, the best way to create a patient is you can either hit this little button up here, roll down to new patient, or you can hit new button down here in the bottom. Now, we're going to create a new patient. The first thing that pops up, you'll see these three red lines. It's essentially demographic information and what kind of patient you have. The quickest way to enter demographic information is with a driver's license. Now, this app reads this digitized barcode in the middle of your license, not the traditional barcode that's on the top. Now, on your app, you're going to see a button that says DL scan. Hit that button, scan your license. You see it scans, it auto-populates. Now, it's entered my name, date of birth, age, sex, all that stuff. Now, moving forward, if you're going to play around with this app, the very first thing you need to do once you've scanned anything is you need to change this name to test. Now, there's an unknown button over here in the side. From today on, if the hospital receives a name or what appears to be a legitimate name, or they receive an unknown name, they were going to consider that to be a live patient, and they think that you're coming in using this app. Now, that's why we change it to test. That's the only acceptable test patient we can enter. Now, we go down here and we select what kind of patient we got. Now, we're going to call this an abdominal pain. I'm just going to hit general and then type in abdominal pain. Okay, I'm done. The next thing we do is we go up here to audio, and I can do a very quick sort of patient report audio. I go to add audio, click record. Hi, this is Jake on Medic 1. I have a 47-year-old male, abdominal pain, GCS of 15, patients are stable, more information to follow. All right, I go back and listen to it again. Hi, this is Jake on Medic 1. I have a 47-year-old male, abdominal pain, GCS of 15, patients are stable, more information to follow. All right, hit save and then back out. Now you'll see it is added one audio file to that button. Now the next thing we're going to do is add an image. Now there's two images you need to add. You need to add a patient image, like in this case, well, you can see this stupid webcam on my face. We're going to use it, back out. Now instead of entering vitals into this thing, take a picture of your monitor. Add a picture of your monitor. Now we're just going to, well, going to add, let's just add a picture of the monitor, which shows all your vital signs and such. We're going to use that photo back. Now we've got two image files. Now, EKGs. Once you've printed out an EKG, take a picture of your EKG. In this case, here's my nice, pretty EKG. We're going to use that. Now, once the hospital goes in and looks at it, they can actually click it, blow it up, look at every tiny little blip and bloop on the EKG, and so on and so forth. So, we back out. Now, the last thing you need to get, I'm sorry, not the last thing you need to do, but the next thing you need to do is add the patient wristband. Now, there's a little icon over here for scanning a wristband. The wristbands are blue in color, and it's got a special barcode on it. We click that, we scan the barcode, it now attaches a special number to that patient. The last thing you do is you set your destination. Once you set your destination, it'll set an ETA. It gives you about a 20-minute ETA once you set. It's not set in stone, and we can change it. Now, once you have all that information entered, you go in and hit this alert button. Do not hit this alert button unless it is a live patient or if you're working with the hospital doing a test. Because what happens is they get this god-awful test alert. This test alert builds and it doesn't shut up until they click it. When they click it, you'll get a notification that they have received your patient information. There is no more, did you guys call, you didn't call, I didn't know you were coming, because this thing is just going to make noise until they shut it up, and they have no choice but to look at it and acknowledge your patient. Now, they'll be able to go in and look at what information you've sent them. Now, I'm going to back out, and I'm going to go to a test patient that we created earlier today. This was me again. The first thing I did is change the name to test number 3. Again, it's got to be test. Anything else is to be considered a live patient. Now, I've got an audio file here. Basically, I give a brief report. 47-year-old male, inbound chest pain, non-STEMI. Now, that was kind of low, but it basically said 47-year-old male, chest pain, non-STEMI. Now, the hospital can respond and ask questions.
What's the GCS?
They're asking me for a GCS. Now, we've asked the hospital to only send requests for information back to us if it's critical information. If they're asking you stuff like when was the last meal, what kind of drug allergies they have, when was their last bowel movement, we've asked them to not send that kind of stuff. But if they do, either ignore it or be nice, and if you have time, respond. Now, this looks like a lot of information, but it really goes very, very quickly. You can create a patient in about a minute and then alert the hospital with what you have. Now, here, you'll see that the hospital has received your request, and it'll actually timestamp when they received it. So again, reiterating, there's no more, we didn't know you guys were coming. That's essentially it. Now, it's very straightforward. It's very easy to use. If the hospital has information that they need from you and they're sending information requests to you, this little icon down on the bottom will turn red. Click it, and then you will see basically a chat thread. In this case, GCS is in here twice. The first time what they did is they physically typed in the initials GCS with a question mark. The second one, what they did is they clicked down here on the message, and they actually did a voice to text message, which it types out for you, and you can see that clearly. And then if I want to send that message to them, I just hit that little button right there, and it'll pop it up over here. Now when they asked me the GCS, I said super busy, stand by. Again, this is sort of predicated on you checking this information. You guys are probably going to be busy doing patient care, or we hope that you're busy doing patient care. So try to get this done as quickly as you can once you hit the truck. If you're adding interventions along the way, go back in the message and say, I've started an IV, patient's on O2, we're now doing end-tidal, patient's taking a turn, we're now bagging this patient. Give information if you can. If you cannot, again, patient care comes first. Get dispatched to relay any critical information if absolutely necessary. Okay, so that is pretty much it. We'll go back to an earlier case we did today. Again, same kind of thing, test. They actually assigned me a room number once they received the message. In this case, it was a 52-year-old male, or I'm sorry, female. Here is the audio message for that one. Just test 1 2 3. I uploaded an image, which was just the guy sitting across the table from me, and just a random picture for an EKG. Again, all this information just kind of pops up as you go. Now down here, we actually did a handoff. We were taking the patient to Lavaca Medical Center, and we broke down, and Yoakum come to save the day. Well, Yoakum ended up taking our patient, so they, of course, pop up. And then later in the day, they did training at Jackson County Hospital, and you can see Yoakum delivers their patient to Jackson County later in the day. If you need to add pertinent information, like let's say, in this case, you can see these labels on top. I don't know if you can see it, but the first label says bariatric patient. The second one says COVID positive. You can go in and add labels to these. I'm going to go to the second test patient because this one's already arrived at the hospital. Now, if I want to add a label, I just hit the add button down here, and there's an icon for label. I can add images, I can add a triage tag, notes, EKGs, I can add contact information, I can add another audio clip, I can add all this stuff. Now, if I want to add a label, I just do label, and then down here on the bottom, I can either click the 2 labels I've already created, or I can add more to the system. Okay, so that's pretty much it. Kind of play around with it a little bit and navigate around with it. Again, be careful. Try not to create a live patient with a real name and send an alert to the hospital. If the hospital gets 10 alerts tomorrow because you guys are playing around with it, they're pretty much going to hate us before we go live with this thing. So they're excited about it. They see the benefit to it. You know, they're on board with it. So, you know, we are too. This is a great system, and we're going to use it to its full potential. All right, guys, y'all have a good one. If y'all have any questions, let me know.